Hip arthritis is one of the most common diseases affecting millions of people across the world. But can a doctor simply go in surgically and clean out the arthritis? I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Osteoarthritis of the hip is a degenerative condition, and it makes movement extremely painful. And it's really common. The CDC says that more than 32.5 million people just in the United States have osteoarthritis. And it's even more common in older adults. Each year, about a third of adults 65 and older report having either knee or hip pain due to arthritis. Osteoarthritis is a form of arthritis that can affect any joint in your body. It affects the bone and cartilage. Now, cartilage is the smooth, rubbery substance that cushions the joint. It's made of collagen and other proteins, and it's found on the ends of the bones inside the joints. Cartilage helps reduce friction and absorb shock. When you move your body, cartilage helps reduce the friction between the moving parts like the bones, muscles, tendons, so they don't rub against each other as much, which would cause pain or damage to those tissues, which happens over time in conditions such as arthritis. Now, osteoarthritis, in those patients, there's damage to those cartilage surfaces, causing pain and causing stiffness in the hip, which can make it impossible for those people to move the way they want or perform just basic daily activities without pain. Now, over time, that cartilage that protects those bones and cushions those bones inside the joints breaks down more and more. So now let's talk about hip arthroscopy. This is what people mean when they say, can we go in and clean it out? You go in surgically with a scope. The surgeon basically makes small incisions at the front of the hip and inserts this tiny camera. And the surgeon then uses that camera to look around, see what's going on inside the joint. The images are sent to a monitor. So in real time, the doctor can see what's damaged inside your hip. This is really common with the knee as well. With hip arthroscopy, in theory, the surgeon could go in and smooth out the damaged cartilage and bone. The problem is there's really no way to repair or rebuild that damage. Studies looking at knee arthroscopy for osteoarthritis, where they go in and smooth out the joint, have repeatedly shown that it only provides short-term relief at best, if there's any relief at all, and it actually seems to speed up the arthritis. Most surgeons would recommend hip replacement instead of just trying to clean out your hip joint if they think that you may need surgery later on anyway, which leads me to hip replacement. Orthopedic surgeons often recommend hip replacement instead of going in and cleaning out the arthritis. Hip replacement is a procedure where you basically replace the damaged cartilage and bone with an artificial ball and socket with metal and plastic. It's usually a last resort surgery because you can't go back and replace the damaged bone and cartilage once that metal and plastic are in. Having said that, many people have good results with hip replacement surgery. So hip arthroscopy is not a cure for osteoarthritis. In theory, it could provide some temporary relief, but again, there's no way to repair or rebuild the damage that's already occurred. Really, it should only be considered as an alternative to hip replacements if other treatments have not worked and you're still in pain with osteoarthritis. I would not recommend it generally. And please note, nothing in this video is medical advice in any of my videos, and including what I'm about to say, but just know there are a number of treatments on the horizon that might be safer, might be more effective than hip arthroscopy. Same with knee arthroscopy, but they may be better than cortisone and traditional anti-inflammatory medications to help you avoid surgery, to help you relieve pain, and maybe help you return to the activities you love to do. I'd love to hear about your hip injury and your experience with it. Please leave those in the comments below. Just understand I can't offer you medical advice in the comments or really anywhere else, but I might try to answer your question in a future video. Make sure to subscribe to my video channel and click the bell to be notified when I release a new video or start a new live stream like my Ask Dr. Geier live shows. Thank you for watching. I look forward to helping you feel, look, and perform better than ever.